Let's talk about illicit or illegal drug treatment centers in South Africa. Now, as the world recently marked the International Day Against Drug Abuse and Illicit Trafficking, our focus shifts to a critical issue plaguing our communities here in South Africa: illegal and unregistered drug treatment centers. Now, according to the Department of Social Development, or DSD, 103 illegal centers have been uncovered across the country. 103. Putting vulnerable people at serious risk, many of whom are desperately seeking help. Joining us on the line this afternoon, we are having a conversation with Mr. Gibson. He is the founder of Tranquility, a registered treatment center. And hopefully we'll also get a conversation with a representative from the Department of Social Development. But for now, we'll kick off our conversation with Mr. Gibson to talk about this very important and rather alarming statistic that we have just been privy to. Mr. Gibson, thank you so much for your time and welcome to The Upside.
Thank you for inviting me.
Rather alarming statistics we're hearing. 103 illegal centers.
Yes, as the problem of substance abuse grows exponentially, so too with the illegal centers if the authorities don't clamp down.
And it's going to be an important one to discuss. And like I said earlier, we're hopefully going to get a conversation with the department or representative of the Department of Social Development about what the plan is going ahead to curb the rise of illegal drug centers. And then also we'll be touching base with you, Mr. Gibson, about having a registered treatment center and what patients can expect in terms of a treatment coming to you. It's 20 minutes after 1 p.m. Central African time. We continue our conversation about illegal drug treatment centers in South Africa right after this. Lives at risk. And we continue our conversation with the representative from the Department of Social Development, Mogotsi Kalaeamodimo, joins us on the line, as well as Mr. Gibson, the founder of Tranquility, a registered treatment center. Mogotsi, thank you so much for your time and welcome to The Upside.
A very good afternoon to you and the listeners of the Upside, and then a good afternoon to Mr. Gibson as well. My name is Mogotsi. My surname is Kalaeamodimo.
Kalaeamodimo, apologies for that. Let's talk about this recent uncovering of 103 illegal centers being found in South Africa. How significant is this in the greater landscape, seeing that there are so many that are popping up and people don't know where to go anymore?
Thank you very much. Thank you very much. The illegal treatment centers, like you have just used the word illegal, it means that people have committed an offense.
Yes.
So what usually happens is that as a department, when we hear about the existence of an illegal treatment center, we do our inspection, we go there, we check, and then we find out the fact as to whether they are registered, and then if we find that they are not registered, we also find out why are they not registered. And then in many instances where some of the treatment centers, because sometimes it is not wise to close people down without helping them to do the proper thing. Some of the treatment centers, upon we visiting them, they immediately now start with the process of registering, and they got registered. But then there are others that we will go to them, we find them operating on a particular street, and then you visit them, they run away, they are going to open on another street. So it's a question of now you are chasing them. So you'll never, it is very, very difficult to know the exact number at a particular point in time to say, okay, there are so many unregistered treatments, and then you be precise. So the number sometimes goes up, sometimes goes up, because it's like we keep on chasing them. And then the process of closing those that are not registered, that's why we have tried to say, okay, this is how we can help you to get registered. If you get we have the following, then you are registered, and then sometimes we will say, okay, we give you a month or two to get your assistance sorted, and then we assist them to get registered. But some do not adhere to the call, and then those are the ones that we now start approaching the court to say, the court give us we get the court order, and then we approve them and we close them. If they refuse to close even upon the court order, now we open a case against them. So that is how we approach the whole thing of illegal treatment centers. But I can tell you is that they because these people are using these facilities for various reasons. Some they use them for vacation. This illegal one, they use them for vacation. Some they use them to be illegal in the country as well. So there are various reasons, and then there are cases where we immediately, if say we want to inspect a particular treatment center and the owners do not allow us in, then we go to court and then we get an order, and then we go there with police. And more especially where we get of the issue of human rights abuse. There we act immediately, and should we find that there are issues of human rights abuse, we close it immediately. Yeah. So those ones we close immediately. So that is how we have been approaching this problem of mushrooming illegal treatment centers.
Mr. Gibson, if you can weigh in on this conversation, founder of Tranquility, a registered treatment center. Let's talk about the service that you then provide as a legal service provider, and the impact that you then have on the patients, as opposed to them going to illegal platforms where their road to recovery may be hindered.
Thank you. Yeah, so, initially, obviously, we look at the infrastructure. The registration process is quite tedious and quite difficult. Okay, it's similar to opening a hospital.
Wow.
But all that's important on the basis of patient safety, patient treatment, patient respect. So one has to meet all the requirements in terms of the municipal requirements as well as the other departmental requirements. So what do we as a registered center offer? Number one is that firstly, we're not allowed to do, things according to woman fancy. We have to meet strict criteria of the department, and that is necessary to protect the patients. And then that involves, number one, the staffing. There's got to be professional staffing, which would include your medical teams. And that's critical, When patients go through withdrawals from substances, there are specific criteria that we've got to adhere to. So one has got to have medical doctors, nurses 24/7, psychiatrists, etc., to deal with that and adhere to the stringent but necessary protocols. The second thing is, and again, it's a life or death situation. And as we've heard over the years, as well as recently, of patients dying in these illicit treatment centers because they lack the proper staff. Then one has to understand that over and above your kitchen cleaning staff, etc., you've got to treat substance users with respect. One has to understand where they come from. And one has to have mental health staff that are proficient, efficient, and qualified in the field. Because more and more what we're finding is that, we're not just treating the physical substance abuse, but what we're treating is the mental side as well. And that is fundamental. And most of our patients that come in now, one finds that they have a dual diagnosis. What does that mean? It means, on one hand, the diagnosis and treatment for substance use, and on the other hand, on mental health conditions. So more and more of these patients require other forms of mental health. So just in terms of staffing, one has to not only have social workers, but one has to have mental health specialists like clinical psychologists, OTs, psychiatrists, to deal holistically with the patient problem. In addition,
Mr. Gibson, so sorry to cut you there. We just have to get our sports news at the moment. I'd love for us to continue the conversation. So if you can just stay on the line for us. That's Mr. Gibson, a founder of the Tranquility, a registered treatment center. We're talking about illegal drug treatment centers in South Africa. We'll continue the conversation right after this. Figile Lingwati has your sports news. Before 2 p.m. Central African time, welcome to The Upside. If you've just joined us, thank you so much. We appreciate your presence on our show, and we certainly hope that you find value in our conversations. We are coming to you live from the Auckland Park Studios in Johannesburg, South Africa. Stream us live on our social media platforms at Channel Africa on Facebook and YouTube. And if you have Android or iOS, download the SABC Plus app. Let's continue our conversation regarding the illegal drug treatment centers in South Africa. Now, according to the Department of Social Development, over 100 illegal centers have been uncovered across the country. We are still joined on the line by the representative from the Department of Social Development. He's the Director of Anti-Substance Abuse. His name is Mr. Mogotsi, Kalaeamodimo. And then we have Mr. Gibson, founder of Tranquility, a registered treatment center, to weigh in on why it's important for patients to go to registered practitioners and centers on their road to recovery. Gentlemen, thank you again for joining us on the line. Let's start with you, Mr. Mogotsi. Regarding these illegal rehab centers, we're seeing quite a lot of them popping up. I remember earlier in our conversations, I mentioned that they are now popping up on a frequent basis. We're even seeing them on social media. People of the likes of Mr. Moloto on TikTok who are supposedly having their own rehab centers, helping people, getting them off the street. But then you hear that there's a bit of abuse, alleged abuse towards the patients. How do we then go about identifying that a center is illegal, not registered? Where do we go to find out if it is? And if there is abuse or known abuse reported from the patients, how do we then address that?
Thank you very much. Usually what happens is that if a person happens to go to the treatment center, when you arrive at the treatment center, there must be a registration certificate hanging there. That is something that is going to guide you to say this is an illegal treatment center, or legal or illegal. But at the same time, for government, this is the process that we usually follow. The social workers, the person should firstly approach the nearby social work offices, and then the social workers are the ones that are going to send a person to the registered treatment center. But if you are from a particular locality and that you don't know whether the treatment center is registered or not, go to the office of the social workers. They will indicate to you whether the treatment center is registered or not. And then coming to the issue of abuse of service users. Immediately upon receiving that type of information, we do our immediate assessment, and then if it is confirmed, then and then it's an illegal one, then we close it down, and then if we find that there's nothing like that, then and then it's illegal, then we encourage them to register. We give them a short period on which they should register, and then failing which we close them down. And then, like I indicated, we there's a process that we follow. We approach the court, and then the court grants us that order, and then the center will be closed.
Mr. Mogotsi, just for clarification's sake, the communities, if they have identified that it might be an illegal center or that there is abuse, who do they approach? The DSD, or do they go to the police?
The community have got the right to approach either the police or the DSDs. Remember, it depends. Sometimes you'll find that it's a crime. The crime is committed. Say, for example, people are being beaten up and so forth. I mean, it should be the police first, and then the police must do their own investigation. But even ourselves, if we hear, we go to police. We firstly go to the police to say, there's this type of a situation that has been reported to us. Can you please go with us, so that we go and check as to whether that is the truth, and then that is how we operate. But if for human rights abuse, more especially where a crime is committed, the first door should be police.
Mr. Gibson, I'll throw the next question to you. We just have a quick breather to take on the show, but I want to throw the next question to you, and this is in relation to patients who have been to illegal rehab centers, and what you then have to do as a registered center to sort of undo some of the work and the trauma that may have been caused from the illegal centers. But you can answer that question right after we take the break. It's 10 minutes before 2 p.m. Central African Time. 8 minutes before 2 p.m. Central African Time, we continue our conversation about illegal drug treatment centers in South Africa. Over 100 of them have been uncovered by the Department of Social Development. And we continue the conversation with the Director of Anti-Substance Abuse, Mr. Mogotsi, Kalaeamodimo. Mr. Mogotsi, let's talk about those individuals at home who want to help patients who are recovering addicts, want to get them on the right path, and they may not have facilities themselves, registered facilities. What would your advice be to them? This is someone who took someone off the street and said, listen, I want to help you. Where should they start, as opposed to doing it all by themselves, and in a way may hinder or jeopardize the recovery of this patient?
I just got the last portion of the question, and I'm not sure what it was related to me.
Yes. No worries. Let me repeat it for you, sir. I was asking for the individuals at home who always want to help the next person, and they see someone in their community who needs help, and they either want to get into a facility and start their journey of recovery as an addict. What is your advice to them, as opposed to them taking on this individual themselves into their own homes and helping them, which may jeopardize their recovery? What is your advice to them in helping them get onto the right path to recovery?
Like I indicated earlier on, the best way, there are two types of service users here. The first one is maybe it's a family member. Then you realize that this person is into substances. What you should happen is that you need to approach the office of the local social workers. Then they will assess the person and check as to whether the person can be treated whilst at home, or this person need to be admitted to the facility. So that is the first point will be the social workers. Or if you know exactly where the treatment center is, you can. We have now amended our policy to allow the walk-ins. so that they can be assessed at the treatment center whether they'll have to be placed on outpatient services or they'll be placed in inpatient services. The second type of the service user will be the involuntary service user. That is where now you find that a person is using drugs to an extent that he is more likely to hurt other people, or is more likely to also injure himself or even kill himself. Those type of situations where the person cannot rationally take a decision to say, yes, I agree to go to the treatment. And sometimes you find that these people, they may be violent and so forth. So the best thing will be approach the social worker, and then the social worker will take the matter to the magistrate court so that the person is sent to the treatment center involuntarily. The reason why we are doing this, we are avoiding a situation where we may end up people kidnapping people and claiming that they were trying to take them to treatment center. So it will be the court that orders that a person be taken to the treatment center. So that is what we call involuntary service users. Those are the two types of service users, and then the process is more or less the same. Approach the local social work office, and then they will assist you. Or alternatively, go directly to the treatment center, then you'll be assisted there.
Lovely. And then we have Mr. Gibson also on the line. He's the founder of Tranquility, a registered treatment center. And earlier I threw a question at him regarding the treatment of patients who have come from illegal rehabilitation centers, and what is the work that has to be sort of undone if there was harm or trauma experienced from a previous center. What do they then need to do as a registered center? Mr. Gibson, do you mind weighing in on that?
No. So, one is trauma, and there's a whole range of other problems relating to your question. As far as trauma is concerned, obviously we've got to manage that. You've heard from our representative from DSD, and yourselves, there were earlier comments on some of these patients being, their human rights have been violated, amongst others, also physically. So that trauma we need to deal with, and we have the capacity to deal with it. But sometimes the impact it has is that it delays the actual treatment. That's on the one end. I think I just want to weigh in on the earlier comment and question on the verification and validation of a registered rehab. One of the things that a lot of these illicit centers do is they inform clients that they are registered. So they register, for example, as an NPO. They get an NPO registration. It's like registering a company. Okay. And, in terms of the terms of reference upon the registration is that they could run a treatment center, but they're not registered with the Department of Social Development, and they don't meet all the criteria. So they advertise that kind of certificate of registration as an NPO, and unfortunately the public gets lied to or deluded to recognizing them as a registered treatment center. So be careful about that. The other thing is, the lack of discipline when they come in, because many of them think because of their previous exposure, they're on a vacation, for example, and they come into a structured environment with a structured program. So they lack the willingness, because the conditions are different in a registered center like ours, where we have a structured treatment program. There are rules and discipline that one needs to adhere to that adds value to the treatment objectives. So that becomes quite difficult, because to a large extent, in some of these centers, there's no structured treatment program. So they've got a whole lot to do. I'd like to just weigh in on something else, if I may, because I'm also looking at solutions as well. And I think, as my friend from the department would agree with, it's very, very difficult to close these illegal centers. It's not as easy as just getting a court order. One needs to get the backing of all the other relevant stakeholders in terms of government departments, etc., etc., to put their shoulder to the wheel, as well as members of the public as well. And, as I mentioned right up front, that it's quite a difficult process to register as a treatment center. It's not going to take less than 2 years, by the way. I'm not only referring to the Department of Social Development, talking about the municipal requirements. For example, number one has to rezone for that particular purpose. And the rezoning process could take anything between 18 months and 3 years, by the way. And then there's other requirements.
Mr. Gibson, I'm so sorry to cut you again. Unfortunately, we have run out of time. Should people need any more information, we'll direct them to your website, tranquilityclinic.co.za. And Mr. Mogotsi, thank you so much for your time this afternoon on weighing in on the illegal drug centers in South Africa. It is now 2 p.m. Central African time. Let's get your latest news now with who do we have today? Who do we have today on the news? Jwalani Tulongwebe.